Singapore will provide financial assistance to those who suffer serious side effects after getting vaccinated for COVID-19 here. Now, testing will also be ramped up, including for high-risk groups like hotel staff. The co-chairs of the multi-ministry taskforce on COVID-19, Ministers Yong and Wong, have laid out Singapore's plans to combat the virus in the first parliament sitting of the year. They cover 4 key areas: vaccination, testing, safe management and contact tracing. Cheryl Goh reports.
It's a clear and simple goal to get as many eligible people in Singapore vaccinated as possible. Health Minister Yong reiterated this again during his ministerial statement, his third update on the government's response to the COVID-19 pandemic. But to mitigate the risk of possible serious side effects after vaccination, for instance, allergic reactions, a financial assistance program will be made available.
While we expect few to need this, the program will give peace of mind to those taking the vaccination. Further details on the program will be provided in due course.
At the moment, healthcare workers have been receiving the Pfizer-BioNTech vaccine, as it's the only vaccine that has been approved for use in Singapore. MP Louis Chua asked whether individuals will be given a choice when more vaccines become available. Mr. Gan said it is unlikely that Singaporeans will be able to choose which vaccine to take.
The allocation of vaccines will largely be based on medical indications of the different vaccines and the suitability of the vaccine for the different population groups, such as availability of the vaccines. Any COVID-19 vaccine that is approved for use will have to meet the stringent safety and efficacy requirements. Allowing individuals to have choice of vaccines will unnecessarily complicate this already complex vaccination program.
Mr. Gan added those who get vaccinated will receive a physical vaccination card as proof. This will also remind them of when to return for their second dose. Their record will also be updated in the National Immunisation Registry, and individuals will be able to check their vaccination status online. Mr. Gan also updated the House that while healthcare workers lead the queue to get vaccinated, preparations for rollout to other groups are also being made at clinics and vaccination centres. They include seniors aged 70 and above who will receive their jabs from February this year. These groups, who are non-healthcare workers, will need to make prior bookings due to cold chain requirements of the Pfizer-BioNTech vaccine. Bookings also ensure operational efficiency and minimize individual wait times. Mr. Gan also responded to an MP query on whether those who are not vaccinated will have their job scopes reviewed.
In most instances, redeployment of non-vaccinated employees will not be necessary unless there is a resurgence of local cases. That said, there may be specific cases such as researchers or laboratory staff working directly on the COVID virus or those who face very high risk of exposure to infected individuals. MOH and MOM are reviewing the issue of vaccination of workers in such workplace settings and will provide advice later.
As new, more contagious strains of the virus emerge, Mr. Gan said it's all the more crucial that we get vaccinated now and not wait till another outbreak occurs and then rush to get vaccinated when that happens.